excited that you are back as we continue to take a look at what those alignment components are related to the essentials, our accreditation standards, and the hallmarks of excellence. If you haven't already, you want to go ahead and print out your study worksheet. You can find that right here in the description. And we also want you to pull out Billings and Halstead. Okay, so we're going to start in a little bit different way in this snapshot. We're going to start by looking at the content that is listed right here in Billings and Halstead. If you're on the journey to achieve certification as a nurse educator, congratulations. We know that it is absolutely that. It's a journey, right? That you have to make sure that you are staying focused and that you're moving forward to close your knowledge gaps. If you are returning as an already certified nurse educator, we're excited for you as well. Make sure that you stay focused on your renewal credits based on the guidelines that have been published by NLN. You can find those guidelines on the nln.org website. And you may be a colleague that's a nurse, or maybe you're a community member. So the reason why you showed up here on our channel, whatever the reason, we are excited that you all are here. So let's take a look at our textbook, page 137 in chapter 7, which is titled The Philosophical Foundations of the Curriculum. Now, we want to bring your attention to figure 7.1 because it's such an excellent image of what those steps are that we should follow when we're thinking about making changes to our curriculum, or maybe you just want to do your 5-year review or whatever your frequency is at your college. The first point we want to identify from this interrelation of curricular elements is our School of Nursing philosophy. So I want you to write down as your homework on your study worksheet, go find your School of Nursing philosophy or College of Nursing philosophy. And then I want you to check the box to determine if there are specific professional values addressed in your philosophy. What about alignment with your institution's mission, vision, and values? And then the third element we want you to take a look at is going to be your personal values and your beliefs about faculty. Okay, so there should be some language in your philosophy about each of these elements. And we want you to do a little bit of self-reflection and consider, what are your goals today? What are your next steps as far as your career? What do you want to do in academia? Do you want to expand and perhaps bring a clinical element into your nursing education career? Okay, so I want you to think about, what are your personal values and missions and goals that you have identified for yourself? All right, and then we also want you to take a look if curriculum is a gap area for you at those external forces and the other different elements associated with the curricular components. Oftentimes when we think about curriculum, sometimes we can feel like it's overwhelming to break down those key elements, but we want you to take some time to really go through this figure 7.1 almost as a checklist of the key elements that you want to consider when you are exploring curriculum. All right, and then next, we want you to bring out your blueprint. Okay, so this is the NLN Candidate Handbook. These are pages that specifically focus on the blueprint for the CNE exam. Now, if you're on the journey to CNE, we know that's important, but even if you're on the journey for renewal, you still want to make sure that you are aligning your strategies to renew and that you have met those renewal credits based on each of the competencies. And we are also excited to share that we have 2 thought-provoking questions in our content for today. All right, so let's go ahead and get started now that we've gotten all of the particulars out of the way. So welcome, we're glad that you're here. And we know that this information that you're reviewing in our time together today will be really important as you think about what your next steps are going to be on your journey. We hear from a lot of colleagues that identifying what their next steps are going to be when it comes to the CNE can be a bit of a challenge, okay? But it doesn't have to be that way. There is a process and a framework that we follow to help you move forward with ease, okay? So that's what we want you to focus on, is what are those next steps going to be so that it will increase your ease and integrate easy follow-through steps. Innovation has the ability to distinguish between a leader and a follower in education and learning. This is a little bit of a cue up to talk about what areas should we focus on when we think about innovation. How do we get our students ready for the innovative strategies that they're going to be exposed to in their clinical setting. Research tells us that more than 2 million nurses, yes, 2 million nurses are already exposed to artificial intelligence. I like to say assisted intelligence because we know that AI doesn't have a brain, right? There may be some data that it draws from that is connected to people, but ultimately it doesn't have a brain. So let's think about what our strategies are going to be to help our students achieve success. Okay, so this is our first thought-provoking question. Which clinical experience would best prepare learners for transition to practice? We have A, interviewing several clients to allow practice with communication skills, B, designing and implementing a care plan during the clinical experience, or C, providing complete care for 3 medical surgical patients. This content that we're exploring today is directly aligned with facilitation of learning, curriculum, change agent and leader, and scholarship. And that's just to name a few, right? You actually could align our content today with about 6 different competencies. All right, so I want you to write down what you think the best answer is. And this is called a thought-provoking question for a reason. Okay, so we want you to think about what are your next steps going to be to make sure you close your knowledge gaps as it relates to the concepts that are mentioned in this thought-provoking question. If you're not sure exactly what the answer is, we want you to write down what you think the best answer is. And for every question on the CN exam, we want you to, first of all, think about what is this question really asking me? And second of all, what is it that I know for sure about content that is included in this question? All right, so now that you've had a little bit of time to kind of think about what the answer is, we're going to go ahead and move on to our the rest of our content that we have to cover for our time together today. And this is what we want you to do as you think about the best answer. We want you to pause, okay? And when we get to the correct answer, so stay tuned. This is just thought-provoking question number 1. We have 2 for today. So we want you to think about what is this question really addressing as it relates to the competencies? And then we want you to reflect. What are going to be your next steps to not only feel more confident and competent in your answer, but how do you integrate these evidence-based strategies into your everyday work? Okay, so that's our ultimate goal. Yes, we want you to show up here every week. We want you to be introduced, hopefully, to some new information, or maybe it's just to validate content that you're already knowledgeable about. But most importantly, we want you to act, right? We want you to execute. We want you to integrate these evidence-based practices so we can truly transform our students in the classroom and help them become better nurses in the future, and hopefully in the future, better nurse educators as well. So now let's talk a little bit about our content that we're going to cover. When you think about innovation, what comes to mind? I want you to go ahead and write it down on your piece of paper. Okay, so what comes to mind when I say the word innovation? Maybe it's AI, maybe it's your learning management system, whatever that word is that comes to mind. I want you to go ahead and write that down on your worksheet, on your sheet of paper. And then we're going to dig deep into some of these key elements that you want to consider. Maybe you've thought about them already, maybe you haven't, but we're aligning it with hallmark number 4, which is innovative evidence-based curriculum. Okay, and we are aligning it with the essentials and with accreditation. Now, each of you probably have a different accrediting body. So whether that's ACEN, CCNE, or CNEA, whatever your credential is for your accreditation, I want you all to reflect on how does this content that we're covering today align with your accreditation standards. So you might want to pull those out if you haven't already. When we think about innovation, oftentimes we consider, okay, how do I move away from the traditional setting, students sitting in a seat and listening to a lecture? There's a role for pedagogy where students really see us as the content expert. I like to use the example when it comes to teaching students about sterile technique. We don't want students teaching themselves. We want to be seen as the expert, aligning our content with those evidence-based practices and content to ensure that students are making safe patient care decisions. So we're breaking free from that traditional mindset of sitting in a seat and listening to content. We want to engage our learners on the journey towards achieving excellence as it relates to safe patient care decisions. All right, so hopefully everybody has had a chance to write down what their answer is to our first thought-provoking question. Now we want to talk about, why do we need the change? We know in healthcare, changes are inevitable. Well, in nursing, it's no different. So why is it that we need to make these changes? That's what I want you to take a minute and reflect on. We have our baccalaureate essentials. We have our competency-based frameworks. We may have different standards that we're trying to meet within our institution. Maybe it's based on accreditation that the university or the college is trying to achieve, right? So there can be so many influences that really trigger our need for change. Oh, and we can't leave out our stakeholders, which is our community members, our healthcare organization. So I want you to write down right now, what are 2 reasons for changes in the curriculum? We've talked about a couple of them, but I want to make sure you're aligning our content today with your actual nursing program. It's important when we think about what those 2 items are. That's the what. So what is driving our change? And then the next consideration is thinking about, what changes do I need to make internally as a faculty member in order to support this change in happening. Lewis change theory is one of them that comes to mind for me. But when we think about changes or transitions we're making in our curriculum, we want to identify a framework and then a process. So framework is first. How are we going to make these decisions? And then second of all, how are we going to execute those decisions and bring our colleagues along on the journey? All right, so if you chose C for the correct answer, give yourself a round of applause. C is the correct answer. So providing complete care for 3 medical surgical patients. Now let's talk about the rationale, right? It's exciting if you choose the correct answer, but it's even more exciting when you understand the rationale. Learning goals may help facilitate learners' ability to synthesize information, integrate didactic and clinical knowledge, develop clinical reasoning and judgment skills, and plan care for groups of patients or clients. Assignments that involve planning care for clients with complex needs and for multiple clients as are appropriate and would assist learners preparing for the transition to practice as an option C. The other options are not the best clinical experiences to prepare learners for a transition to practice. Okay, so that's the rationale. Remembering that the other 2 options said simply interviewing, which that's good, but the best answer, the more holistic answer, is going to be caring for complete care for 3 med-surg patients. And then B, designing and implementing a care plan. Again, that's great clinical experience. But the question was, what would best prepare our learners for transition to practice? Okay, so that's the rationale for C being the best answer. If you didn't choose the best answer, we do have another option for you. We know that many colleagues struggle with identifying the correct answers from some of the practice questions. So oftentimes we get requests from colleagues for more practice questions. Well, we don't create practice questions. We create exactly what we describe as our thought-provoking questions. That's what we want to trigger. We want to trigger for you what doubts are coming up or what gaps are identified based on the question that we are sharing in our thought-provoking questions during our snapshots, or even if you choose to download our thought-provoking questions on our website. That's also listed right here in the description. When we're embracing technology and innovative teaching strategies, we want to think about also, how can we help students work together better, especially since we're teaching adults. So project-based learning is what you want to consider. This is truly what helps transform the learning experience for our students, creating those high-impact teaching strategies that allow students to have hands-on experiences where they're able to apply and analyze the important patient care concepts that we need to validate in the skills lab, sim lab, and ultimately in the clinical setting. All right, so this is thought-provoking question number 2. All right, everybody ready? Okay, so Dr. Smith leads curriculum revision at a nursing program facing declining NCLEX pass rates and poor student engagement. While some faculty prefer sticking to traditional lecture formats, Dr. Smith pushes for a shift to concept-based, evidence-informed instruction aligned with NLN Hallmarks, AACN Essentials, and ACEN Accreditation standards. Faculty concerns center around the time and training required to transition. So, what is the most strategic first step Dr. Smith should take to move the curriculum towards innovation and alignment with national standards? A, begin with the program-wide curriculum meeting to ensure faculty compliance to expedite innovation. B, pilot evidence-based teaching strategies in one or two key courses while engaging faculty in shared decision-making. Or C, maintain the current curriculum until we have more NCLEX data, then present innovation as a last resort solution. So I want you to think about, what is this question really asking me? And what is it that I know for sure about content in this question? Okay, so I'll give you a second to kind of think through what the best next step should be, or the first step, the most strategic first step that Dr. Smith should take. Okay, so just to recap what we started with related to our philosophy or our statement related to innovation is that innovation has the ability to distinguish between a leader and a follower. So how can we do that today? You reflect on where you are as it relates to innovative teaching strategies, those high impact teaching strategies in your classroom as a first step. And now I want you to think about where you sit on this continuum. Are you a follower as it relates to innovation, or are you a leader? We know we have to have both. And as we move forward with different transitions we're making in our curriculum, there are times certainly where we can be a follower, but then there are other times where we have to be a leader. All right, so I want you to think about this question and really this statement. Where are you on the continuum when it comes to innovation? All right, so for Dr. Smith, if you chose B, pilot evidence-based teaching strategies in one or two key courses while engaging faculty in shared decision-making, you are correct. So give yourself a round of applause, okay? And the reason why, this is the most important part, which is all around rationale. Small-scale piloting allows data collection, builds faculty confidence, and models best practices aligned with NLN Hallmark number 4, AACN Essentials, and ACEN standards, just as one example, all of which emphasize evidence-based innovation and collaborative curriculum development. Mandates without buy-in, such as A, and waiting for further decline, right? Wait until we collect more data. Well, that's not the most strategic first step, right? That can lead to program outcomes declining and accreditation standards not being met. Okay, so that's not the best strategic move that we want to make, right? We want to think about what is going to be best to move our program forward, and most importantly, to help our students achieve success. So what's your number? 1, if you're feeling a little lost. 5, if you're ready to teach. You can always reach out to us, info@drsellerseducate.com, or you can find information on our website 24/7 at drsellerseducate.com. Okay, that's our website. If you feel like you're getting stuck, we want to invite you to join our monthly boot camp. Dr. Sellers Educate is approved as a provider of nursing continuing professional development by the North Carolina Nurses Association, an accredited approver by the American Nurses Credentialing Centers Commission on Accreditation. So what this means is not only can you connect with us to ensure that you are provided valuable evidence-based information, also it's eligible for a contact hour, okay, as long as you stay the entire time or watch the full recording. Congratulations on getting one step closer. Make sure you subscribe to this channel and hit the notification bell so you'll be notified every single time there's a new snapshot, which usually happens every single week. All right, we look forward to seeing you in our program, and we will see you in our next snapshot. Have a great one, everybody.